Hello, I'm Dr. Ken Muhich, Medical Director of the Fibromyalgia Wellness Center in Scottsdale, Arizona. I'm here to share with you a protocol that I have developed for fibromyalgia patients and hope that you will decide to attend the training seminar that I have created. I understand that you don't know me, and why would you even consider listening to what I have to offer? My hope is after you hear a little of my story, you'll change your mind. I'm a graduate of Palmer Chiropractic College. For over 30 years, I'm very happy with my practice. In 1990, my clinic manager came into my office to tell me that there was a lawyer on the phone that wanted to speak to me. Little did I know that that brief announcement would change the direction of my professional life forever. The lawyer on the other end of the phone line explained that a patient that I had treated a year earlier had an automobile accident, and from that trauma, she had developed a condition called fibromyalgia. My mind went back to the patient he shared, and I remembered her coming in with complaints of a stiff neck and headache. After completing my exams, I concluded her diagnosis was straightforward, cervicalgia or neck pain, and that brought on the accompanying headaches. Treatment consisted of a few chiropractic adjustments and physiotherapy, and after a few treatments, she was released from my care. The lawyer shared that her insurance company had claimed the young woman's fibromyalgia was pre-existing and that her visit to my clinic proved that she had this condition prior to her accident. I was asked to testify on her behalf, which was the beginning of my educational journey to fibromyalgia. I hadn't diagnosed the patient with fibromyalgia at all. So in order to learn more, I contacted the University of Arizona Medical Library to do my research. They had a research paper from the American College of Rheumatology. It was a very long paper full of medical jargon and small type. It gave me all the information I needed to prepare for my testimony on behalf of the patient. When I got to the court, which included a jury, the insurance company attorney was very demeaning with his anti-chiropractic comments, and at one point said, "Oh, and you got that answer from your chiropractic school?" It was a comment I had been waiting for, and I said, "No, it came from the American College of Rheumatology, 1990 research paper, and I have a copy for the jury." You could have heard the lawyer's jaw drop to the ground, and I saw the jury lean in to hear more. Before my testimony, everything said to the court by the other health providers was just their opinion. Valid peer-reviewed research publications always supersede opinions. The insurance company settled in favor of my patient for the largest amount for a soft tissue injury causing fibromyalgia up to that time. From this point forward, my reputation for knowledge of fibromyalgia began to grow, and patients started calling and scheduling appointments. I felt like an army of one, and in Arizona, I couldn't find even 5 medical professionals who were treating the disease. Rheumatologists' general attitude at the time was they were stuck with this condition and they prescribed pain meds and antidepressants. Patients were told it's all in your head. These patients were guinea pigs for Western medical professionals, and some patients were driven to suicide after being told they were crazy by health providers. What they were doing was literally killing them instead of helping them. One morning I picked up the local paper in Arizona, like this, and read the story about a woman, age 30, who had visited a dozen doctors in many emergency rooms, complaining of shooting, burning pains, body spasms from head to toe that forced her into a wheelchair. She was given only prescription and pain pills, which had no effect on her symptoms. One morning in the year 2000, she decided that pills were not an answer. She sent her husband off to work, got her 3 young children taken care of. She drove out to US Highway 60, parked her car, got out, walked to the highway and stepped in front of a truck. I was horrified. Newspaper reports stated some doctors choose not to recognize fibromyalgia, and they don't diagnose it in their patients simply because they don't know anything about it. I said to myself, this should not be happening in our country. It was that day that I was committed to doing something about it. I worked tirelessly to do all I could to learn about this disease. I attended a seminar by Dr. R. Paul St. Amand, an MD, who has fibromyalgia, was treating fibromyalgia patients in his California clinic. He would become the mentor in my journey. After learning about his protocol and talking to patients about their improved symptoms, I began to use it with my own patients. yet I wasn't seeing the true recovery that I wanted from them. I did more research and conducted clinical trials on a pre-protocol that I developed to focus on treating the underlying condition so that all the symptoms would be eliminated. This became my passion and obsession, if you want to say that, and it paid off. I've been fortunate to help many patients over the years get their lives back. And if you go to my website, fibrowellnesscenter.com, you can see a video of many of them sharing their stories. So why am I here speaking to you? Because there's more than 6 million patients across the country who are suffering from this debilitating disease, and at least 6 million more that have misdiagnosed. With your expertise and a patient's willing and dedication to their health, we can help them heal. I have developed the Fibromyalgia Recovery Solution, a step-by-step training that will help you efficiently diagnose the condition and get the patient started on a proven protocol where they will see results in just a very short period of time. It's been the most satisfying work of my life. Because of the time spent on research, clinical trials, and treating patients, networking and building an expansive platform for you to recognize my name and hear about my accomplishments, they weren't a priority. Witnessing the outstanding improvement I have seen with my patients, my goal now is to share this successful treatment protocol with other doctors. I have included information about the curriculum, what you'll receive from the training and additional value items to assist you in building your practice. You can read all about this in the information below. Starting October 8th, I'll be teaching a 6-week, 2-hour online webinar that you can enroll in, or come to Scottsdale, Arizona for a live training with me on October 6th and 7th. Choose the best format for your schedule. I'll teach you about the Fibromyalgia Recovery Solution I have developed and get you going so that you can go to your clinic and begin treating fibromyalgia patients immediately. I truly hope I have shared enough of my story to make you feel comfortable in registering. It's less than $400 for 12 certified educational units, and again, you have a choice to learn from the live webinar series or come enjoy a few days in Scottsdale. I truly want to thank you for your time in listening to learn a little bit about my journey, passion, and training. Again, all the details are outlined below. I guarantee you that this part of your practice will become very rewarding, and it sure has for me. These patients have been suffering for years, taking multiple prescriptions and not getting anywhere. Together we can make a difference in their lives. Thank you again, and I hope you will sign up today. Feel free to contact me at my office at 480-948-4955 if you have any questions at all. And thank you very, very much.